Whilst playing with his dog, he suffered a cardiac arrest. Their hardest decision is always when to stop trying to save a life. 45-year-old employee Joe was at work stacking shelves when she collapsed. Luckily for her, the ambulance crew arrived within 2 minutes and managed to restart her heart.
Well done, guys. Okay. She's got a candle in.
Yes, she's got
So, keep her on the side there.
family behind.
Yeah, gotcha.
And then work colleagues.
The paramedics have hooked Joe up to an electrocardiogram, which shows a very agitated heart rhythm.
That 12 lead, did you see anything on it?
Came back at stomach.
Her daughter-in-law Jade is also on scene.
Looking after her, it's good that she's away.
Joe's brain was deprived of oxygen for several minutes, which has left her confused. Mitch needs to calm her down to minimise the stress on her heart.
I need you to sort of be around and talk to her. So if you go behind my colleague there, you just talk to her.
The team now need to get Joe to hospital as quickly as possible. It's her best chance of survival if she does have another cardiac arrest.
She went to the doctor yesterday because she had pain in her arm.
Pain in her arm.
But she couldn't get any appointment. You okay, Joe?
So everybody on the side, pull apart slightly as well. So, and then just watch everybody's toes. Okay.
1, 2, 3.
Okay. Advance. Mind your toes.
Go on your
okay, lovely. Okay, so guys, can we go a little bit further over that way, and then put her on her side? Okay, because if she vomits,
It's 26 minutes since Joe had a cardiac arrest, but Mitch knows the window for her rearresting is still wide open.
Can I just insist that we keep her on the defib? Sorry, we need to know what's happening, don't we?
The cardiac monitor contains a defibrillator, which can be used to deliver an electrical shock if her heart rearrests. 6 minutes after he arrived on scene, Mitch has his patient packaged and ready to leave. There is a real chance of Joe rearresting, so Mitch will travel with her to continue giving emergency care throughout the 4-mile journey.
So, guys, what we're going to do is, if she has another arrest, we're going to do 3 stack shocks if needs be, OK? Happy with that?
Yeah, sound like
OK.
Joe, how are you feeling? Okay.
Liam, just nice and smooth, mate. What we're going to do is we're going to do a cannulation in a bit, but I'll tell you when it is and we'll just pull over slightly, OK?
The cannula will allow Mitch to administer painkillers directly into her bloodstream, as well as prepping her for immediate treatment at hospital.
Yeah, that's probably from the compressions on your chest. Gonna get you sorted, lovely. You're doing really well, OK?
Just 4 minutes later, they arrive at hospital,
Good skills, top marks.
where Mitch delivers his still critically ill but now stable patient to the waiting emergency doctors. With cardiac arrests, time is everything. Every minute that goes by without someone attempting a resuscitation, the chances of survival drop by 10%. On arrival, ambulance crew members are working hard to save support worker Vanessa.
OK, was she asystolic when you got here?
Yeah.
OK, so first crew, she was asystolic.
Basically, we went out. We've done a few rounds of compressions. We're trying to get access because we need to give adrenaline.
She has been asystolic without a heartbeat since they got there.
Your family, what's happened? Is she an asthmatic? OK. Have you found her in cardiac arrest?
Earlier, Vanessa, who was alone at the time, called a relative to tell them she was having an asthma attack. When she failed to answer her phone after they called back, her nephew went round and found the 50-year-old collapsed. No one knows how long ago her heart stopped beating.
We've got an ideal in airway and Tidy's a little bit low, so we just have to go slow on the ventilations.
OK.
And we're just getting the reversible courses now.
I'll tell you what, I'll come around the top end.
Because Vanessa doesn't have a heartbeat, it can't be shocked back into a workable rhythm with a defibrillator. So they will use chest compressions and drugs to try to get it started again.
OK, let's check the pulse in 2 places, please.
Nothing here, mate.
OK, so that looks like asystole to me. Back on the chest then for 2 minutes, and let's see where we're going.
After each cycle of chest compressions, Pete checks to see if there is the slightest spark of life.
Just done a pulse check. We're 1 minute 20 to the next pulse check, but she's in asystole, so we're going to start trying to redress some reversible causes. Okay. All right, so have we got any access? Just about. Okay, let's get some adrenaline and the glucose set up if we can.
Adrenaline and glucose are stimulants that could trigger activity in Vanessa's heart. The entire team are doing everything they can, but with Vanessa still showing no signs of life, Pete knows they don't have much time left to save her.
Can we just do a pulse check? What have we got there?
Write it all down.
Okay, there's no pulse at the...
Okay.
But after 20 minutes of fighting to get her heart started, there is still no sign of life.
Will this move under her legs? Let's raise her legs, see if that helps anything.
By raising Vanessa's legs, Pete hopes gravity will send blood closer to her heart and may prompt it to restart.
So there's no pulse at the carotid.
An end tidal is 1.3 despite 20 minutes of good ALS. But can somebody have to have a chat with family regarding that, or is that all right? And I'll continue with timings. Is that all right? Okay. Yeah, let's continue. Is anybody in a position to find out the time of the call?
Their hardest decision is always when to stop trying to save a life.
We've got an unknown downtime. We have had some CPR on crew arrival, but we don't know when she's actually arrested, and blue on arrival, apparently. So the things that are going against us, she's not been in a shockable rhythm at any point. We've done 20 minutes of ALS.
20 minutes on the monitor.
OK. Do we need to reconsult family, or are you happy with that, Bobby? Has anybody got any objections to stopping? OK, is everybody happy to stopping? Recognition of life extinct. By my time, that's 16:13.
A crew member informs Vanessa's relatives that despite their best efforts, she has died.
Step, lift. Into the yeah, it can be emotionally draining, I think. But at the same time, you have to sort of detach yourself from the emotional side of it if you can. There will always be jobs where you can't detach yourself. There'll always be those jobs that always stick in our minds that we all keep locked away somewhere, the jobs that, you know, you can't really forget. But I think you've got to be quite thick-skinned.
There are more than 30,000 out-of-hospital cardiac arrests in the UK every year. The overall survival rate is just 1 in 10. 57-year-old Ian is a full-time carer for his mother. Whilst playing with his dog, he suffered a cardiac arrest. His sister made the 999 call.
When we arrived at the scene, we found the patient on his knees, slumped forward. He had got some trauma to the head, small head injury, but no palpable pulse present.
It sounds like he's probably had a cardiac arrest, fallen forwards, banged his head. Would you agree?
Yeah.
Fortunately, the ambulance crew were on scene in 3 minutes and have managed to get Ian's heart pumping again.
We'll put him back on his side if you're happy with that.
Yeah.
Off to the back of the ambulance, off we go.
Blood pressure 103/69.
Yeah,
Mitch.
OK. So what we can actually do is start reducing his O2.
Although Ian's heart is beating, he's not getting enough oxygen to his brain. It's leaving him restless and confused.
So the idea of putting him on his side is that he's not trauma-related. Well, we don't think it's significant trauma to his neck. If you lie him on his back, as you can see, he's starting to get a little bit agitated.
Ben and Mitch now need to make sure whatever caused the cardiac arrest doesn't happen again. They suspect an occlusion or blockage of a coronary artery, which is a vessel which supplies blood to the heart. As Mitch and the ambulance crew manage Ian's airways,
Hi there. Has anyone had a chat to you yet? No. What relation are you all? Sister.
Ben speaks with Ian's relatives.
With anyone that's had a cardiac arrest, the risk is the lack of oxygen to the brain, and it's how much time has been down with that lack of oxygen, which can make quite a big difference. So by no means we're out of the woods.
Mitch and the paramedic teams need to get Ian off the floor, onto a stretcher and straight to hospital.
OK, yeah.
Let's go have a chat with the family, all right?
And then what we'll do is we'll take him off the scoop once we're in the back of the ambulance, all right?
As he's still critically ill, Mitch will travel with Ian to New Cross Hospital in case he has another cardiac arrest.
Ian, Ian, it's the ambulance. Can you... Well spotted. Cool.
Ready to go, yeah?
Happy?
Ian is agitated. This could be due to a lack of oxygen reaching his brain while he was having a cardiac arrest. He urgently needs assessment at hospital.
Just really nice and smooth. So if he does arrest again, guys, it's like 3 stack shocks. But what we'll do is, whilst it's charging, we'll try and do a bit of CPR.
Although Ian is breathing for himself, he's still confused and disorientated. So Mitch gives him a sedative called midazolam, a drug used to help sedation as he continues to breathe for himself again. 50 minutes after the 999 call, Ian is handed over to the cardiac team at New Cross Hospital.
Ambulance services, the patient breathing.
No, he's not.
How old approximately do you think he is?
Mid-60s?
He'll be lying down
Yes, he is.
on his back.
Yes.
I'm going to give you information on how to give basic life support, okay?
Yeah.
Put one hand flat in the centre of your chest, put the other hand on top and lock your fingers together. Keep your arms straight and push down hard and fast. You're going to push about 2 times a second and say push out loud so we'll know how fast you're going. So you're going to go push, 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 push. Keep going, don't stop.
Push, push, push.
Tom and Mitch reach the location within 5 minutes of the call. They take with them a device known as the Lucas that can perform chest compressions mechanically. On the towpath, 2 ambulance crews are already attempting to resuscitate the patient. Alan, who is in his 70s, had been out walking when he collapsed. A passerby found him unconscious and dialed 999. He performed CPR until help arrived.
So an unwitnessed collapse. Okay.
Asystolic on arrival, CPR in progress.
Okay.
2.5 minutes now. Still warm to touch, but we don't have anything here.
Okay, that's fine.
Alan is asystolic, which means there's no electrical activity in his heart and no heartbeat. Shocking him with a defibrillator would have no effect. They need to try and return some electrical activity to Alan's heart.
Good ventilation with the eye gel and good compressions.
Ventilation is used to artificially pump air into Alan's lungs, while chest compressions keep blood and oxygen flowing around his body, buying time before his heart can hopefully be restarted.
So, in summary, we've got an asystolic cardiac arrest. He's an unwitnessed cardiac arrest, but has had bystander CPR. We've now got a good airway.
Yeah,
We're doing ventilations. You're doing some drugs.
8:30, mate.
8:30 for the first adrenaline, and then we could do a temperature on him in a bit, just to... Great, Sarah. And I think that will give us an indication if he's been down a long time or if he's, if he's been down a relatively short time.
I would agree.
Help.
It seems like quite a recent collapse.
Does he feel
It feels very warm in his core.
Okay. Okay, so that's quite recent then, isn't it? So he is pretty warm, considering how cold it is.
Every minute that someone's in cardiac arrest without treatment, their chances of survival decrease by 10%. But Alan's core body temperature suggests he was found quickly.
I think considering that, we should stay here for the next about 10 minutes and then really do everything we possibly can for this gentleman. What we're going to do, while everyone works around, is we're going to put the Lucas on him, just then we can just do some good effective CPR.
OK, roll him over. That's it, back down.
The Lucas device performs highly effective chest compressions mechanically. But although CPR is helping to pump blood and oxygen around Alan's body...
His end tidal's good, isn't it? 5 point.
Yeah.
After more than 10 minutes, he's still asystolic, also known as a flatline. Using a defibrillator when there's no electrical activity in the heart would have no effect.
My thoughts are, we do know he's an unwitnessed cardiac arrest and he's asystolic. This is not a traumatic arrest. We're happy this is a medical arrest and there's no other reversible causes. Those factors normally associated with pretty poor outcomes. I think what we'll do, we'll carry on for another 5 or 6 minutes. We'll give one more adrenaline. If there's any change after that, then that's great.
Okay, that's your next adrenaline in, Tom.
OK, thank you.
That, to me, looks like
Bit fine VF, isn't it? OK, so carry on with some CPR.
At last, there are signs of improvement. Alan's heart is in ventricular fibrillation, or VF. His heart is beating in an abnormal rhythm, but it is beating.
OK, 2 ventilations for me.
Finally, with electrical activity detected in Alan's heart, Mitch and Tom can use a defibrillator to apply electric shocks.
Everyone stand clear.
So far, Alan's heart is not responding.
So that is shock number 4, isn't it?
Yeah.
So it looks a pretty poor VF, doesn't it?
Trace, isn't it?
It's kind of deteriorated a little bit. 17 minutes in. I think we'll evaluate at 20 and we'll go from there if that's all right. But we'll carry on. We'll carry on with it, I think. Yeah, everyone's
all
clear. Okay, shocking.
Okay.
After nearly 20 minutes of CPR, adrenaline and electric shocks, Tom and Mitch have a decision to make. And it's one of the most difficult a medical professional is ever called upon to undertake.
Okay, so we've got what looks like a very poor ECG. And could someone just quickly feel for a pulse while we're there? No pulses. All right. We've got an unwitnessed cardiac arrest who's asystole. I think, considering that, we should stop now. Is everyone happy with that? Yeah? Yeah? OK, well done, you can stop. Perfect. Cheers. Happy with that?
Despite everyone's best efforts, Alan cannot be saved. Forklift driver Andy was leaving work with 2 colleagues when he collapsed. When the ambulance crew arrived, they were able to use a defibrillator to shock his heart back into a working rhythm. Andy is now breathing, but Tom and Ross need to monitor his heart rate and oxygen levels closely to make sure his blood is circulating properly.
You're happy just kind of get him all blocked away. Ross, I just want you to keep an eye on his knobs and stuff like that, and we'll just manage him from there.
When he fell over as well, apparently he banged his head on the floor.
OK, thanks for telling us. Right then, let's get this under him.
Andy's in a very vulnerable state. Tom knows the best chance of saving their patient is to get him to a hospital that specialises in cardiac care.
OK, so just going to roll on 3. 1, 2, 3, roll. Perfect, and back down. He's got good pulses, so he doesn't need anything. Good. Yep.
The ambulance crew have IV access in case they need to administer emergency drugs to try and restart Andy's heart en route. They need to get Andy to Birmingham City Hospital Specialist Cardiac Unit for urgent treatment. Tom thinks Andy is suffering from a myocardial infarction, commonly known as a heart attack, where the supply of blood to the heart is suddenly blocked. It needs to be unblocked in an operating theatre to prevent permanent damage to the heart muscle.
Yeah, I've got a radio. We've got blood pressure on here, 163 over 106.
The ambulance crew used a defibrillator to shock his heart back into a workable rhythm. It is now beating fast and erratically.
I think the only issue is his sats aren't great, is it? No. So we'll put him on the Mapleson.
Yeah.
And then I'll get you to just go by his head, if that's all right, Ross. And you can manage his airway from the top there.
Because his circulation stopped, the oxygen saturation levels in Andy's blood have dropped to 85, worryingly low. The best hope they have of keeping him stable on the journey is to maintain his breathing using an oxygen delivery system.
The only thing we can really correct here is sats are a bit rubbish. Jacob, can you repeat the blood pressure for me, please?
To manage Andy's vital airways, Ross wears level 3 PPE.
So just jaw thrust, mask. Perfect, okay, good. Let's see if we can get a better trace on that sats probe.
As oxygen is pumped through the mask.
And blood pressure's reading. Got an access. 160. He's relatively flat, so I don't think he's going to need sedating or anything like that at the moment. The main thing just to keep an eye on is just trismus. So if he does lose his airway, then we'll do something about it. But in the meantime, we'll just leave it as it.
Even though Andy is barely conscious, there's an acute danger he may become agitated and clench his jaw, which could jeopardise his breathing.
He's shifting quite well, isn't he?
4 minutes into the journey, Andy starts to show signs of fighting the breathing system.
Is his jaw still a bit tight? Yeah.
Midazolam is a sedative that will make managing Andy's airway easier. Tom administers a small dose through the cannula. Arriving at hospital, Andy's oxygen levels are finally showing signs of improvement. In Solihull, the critical care team led by Dr. Matt Boylan and Dr. Lewis Miller are with Michael, who had a cardiac arrest while out jogging.
Found him.
Yep.
Initially, found him face down on the floor. I was 2 cars behind him. No bike on scene, had no breathing.
Okay.
No respiratory effort, no pulse when we come up. So we've done straight on CPR.
Finance broker Michael was out jogging when he collapsed. Fortunately, off-duty paramedic Leanne was passing by. She realised Michael was in cardiac arrest and immediately started life-saving chest compressions.
Has he got a good carotid pulse, has he?
Yeah, good carotid.
Okay.
Michael is now breathing, but he could arrest again at any moment.
Do you want to see if he'll just tolerate an eye gel in there at the moment? And then we can just support his ventilation.
Michael needs urgent hospital care, but before they can travel, his condition must be stabilised as much as possible.
Let's see if he'll tolerate that there. So are you right just screwing that bit on and then putting the end on there? And we'll just get it all touched up. And I'll switch it into a circuit in a second.
Dr. Matt first inserts an airway device to increase the supply of oxygen into Michael's lungs.
There we go. It's all okay. Let's just check we've still got a pulse there, haven't we? 12 litres, good call. I'll get some clothes off and then we'll get some access on him.
Michael is tolerating the plastic airway, but there's a risk he will become agitated and fight against it. This would place more stress on his heart and brain and could send him back into cardiac arrest. The team decide it's safest to put Michael under a general anaesthetic in the ambulance, intubate him and let the ventilator breathe for him. As they are managing Michael's airway, the team must wear full PPE.
Nice and relaxed, okay?
Although barely conscious, Michael has become agitated and is fighting against the airway device that's helping him breathe.
I'm just going to give him one just now.
Dr. Lewis administers a dose of the sedative midazolam.
Reasonable CO2, good blood pressure. Satch, can I grab another flush? Just giving 2 1-milligram boluses of midazolam just because he's getting, quite. You're all right, mate.
So what we'll look to do, guys, we'll look to pop him asleep, all right? And convey him in. You have to take the top end.
Yes? Yeah.
The team are now ready to begin the process of anaesthetising Michael before intubating him to take control of his breathing.
Bougie out the bag.
And give a flush of that for me. Then any dramas, still got good stats. I'll jump in if burp doesn't work.
Yep.
Okay, a second operator.
Absolutely.
That doesn't work, eye gel in, bag him up. That doesn't work, surgical airway in there.
Yep, absolutely.
Happy with that?
Yeah, absolutely.
With everything in place, Michael can now be anaesthetised. After sedation, Dr. Lewis administers a dose of rocuronium bromide, a fast-acting muscle relaxant that will allow the team to insert a breathing tube down into Michael's airway.
3 at the lip, so about 22 at the teeth there.
With the tube in place, Michael's breathing will now be controlled by a ventilator.
So we've got good blood pressure, good numbers there. We'll ventilate him down. Let's turn that off.
We're just prepping for transfer. We just need to get some bits and bobs and get him fully secured, and then we should be good, all right?
With 15 minutes until they arrive at the Queen Elizabeth Major Trauma Centre, the team must closely monitor Michael to keep him as stable as possible for the rest of the journey.
Switch those over to some new pads.
An hour and 10 minutes after his heart stopped beating, Michael is delivered into the care of the waiting cardiology team.